So if you think about patients getting vaginal tightening procedures, I mean, they will look their surgeon right in the eye and ask exactly when they can go back to lifting heavy at the gym.
Oh, absolutely. Down to the exact day.
Right. They'll ask for a highly specific timeline on, when they can resume having sex or when they can take a bath.
Yeah.
But for some reason, they are often completely silent when it comes to asking if it's safe to pop open a bottle of wine.
It is such a glaring blind spot in the recovery process. And I mean, you see it constantly in the clinical guidelines. People invest thousands of dollars, not to mention going through a significant amount of physical discomfort into these procedures.
Yeah.
And then they just sort of guess when it's safe to have a margarita to celebrate.
Which brings us to the core mission of our deep dive today. We are answering a highly specific, but honestly a very crucial question. Can alcohol affect healing after tightening procedures?
And the short answer is yes, but the how is just fascinating.
It really is. We've pulled together this massive, really fascinating stack of sources for you today. We're looking at medical clinic guides that cover vaginoplasty, pelvic organ prolapse repair, and laser vaginal rejuvenation.
Right, the practical day-to-day clinical protocols.
Exactly. And we're pairing those practical guidelines with some incredibly dense scientific papers on immunology, inflammation, and fibroblast function, just really getting into the cellular level.
And we really need to set the stakes right from the start for you, because we aren't just talking about waking up with a mild headache or feeling a bit sluggish.
No, not at all.
We are talking about alcohol actively dismantling the very cellular mechanisms that make these tightening procedures work. When your body is in a state of active wound repair, especially in the delicate, highly vascular tissues of the pelvic region, introducing alcohol completely rewrites your body's biological priorities.
Okay, let's unpack this. Because before we can truly grasp how alcohol acts as a wrecking ball in this scenario, we need to understand the baseline.
Right, the normal healing process.
Yeah. What is the body actually trying to build? Like, what's the physiological goal of these tightening procedures in the first place?
Well, whether you're looking at a surgical intervention like a traditional vaginoplasty or a pelvic organ prolapse repair, or a non-surgical procedure using energy devices like CO2 or erbium YAG lasers, the fundamental goal is tissue restructuring.
Huh.
Your body has to physically rebuild itself to create a tighter, more elastic, and structurally sound architecture.
Now, I want to focus on those non-surgical laser treatments for a second, because the sources describe them as relying on I think the term is controlled thermal injury.
Yes, that's the exact medical terminology.
Now, that sounds like a total oxymoron to
Yeah.
me. You're intentionally burning the tissue in order to heal it.
It does sound entirely counterintuitive, doesn't it? But the laser energy is absorbed by the water in your connective tissues, and that creates a highly targeted, microscopic thermal effect.
So it's just tiny pockets of heat.
Exactly. It's essentially causing tiny, controlled areas of damage while leaving the surrounding tissue intact. And that heat produces immediate edema, which is swelling over the first few days.
Wait, but I always thought swelling was a bad sign. Like if you twist your ankle, you immediately ice it to stop the swelling, right? Why do we actively want swelling here?
Yeah, that is a very common misconception. We've been trained for so long to just suppress swelling at all costs. But in the context of a controlled, intentional injury, swelling is essentially a biological alarm clock.
The alarm clock.
Yeah, it rushes fluid, nutrients, and signaling proteins to the area. And that specific alarm clock wakes up a really vital type of cell called a fibroblast.
The fibroblasts. Okay, if you're listening, keep that word in mind because they are the absolute VIPs of everything we're discussing today.
They really are the stars of the show. Once the fibroblasts are stimulated by that initial injury and the resulting swelling, they begin a process known as neocollagenesis.
Meaning making new collagen.
Exactly. They start producing brand new collagen and stimulating the growth of new blood vessels. That biological process is what ultimately increases the thickness, the elasticity, and even the natural lubrication of the vaginal lining.
It makes me think of like a major home renovation. The surgeon's scalpel or that clinical laser is essentially your demolition crew.
Oh, that's a good way to look at it.
Right. Like they come in, they clear the site, they create the necessary damage to get the project started. But the demolition crew doesn't actually build the new house.
No, they just prep the ground.
Exactly. The fibroblasts are the actual builders. They're the ones showing up to the site the next day, mixing the cement, and pouring the new concrete, which in this case is the collagen, to make the new structure tight and strong.
I really like that framing. And because the entire success of the procedure rests entirely on the shoulders of those builders, Anything that impairs them threatens the whole operation.
Makes sense.
If the fibroblasts don't do their job, the demolition was for nothing, and the tissue just won't restructure properly.
Which brings us to the direct hit. Let's introduce alcohol to the job site. What actually happens when those builders are exposed to a few drinks?
It's stark. It's really stark when you look at it under a microscope. We have studies tracking fibroblast function after acute ethanol intoxication.
Okay.
A single exposure to alcohol, and we're talking about reaching a blood alcohol content of just 100 milligrams per deciliter, which is, just slightly over the legal driving limit in many places, directly impairs fibroblast proliferation.
Wait, it impairs it by how much?
By up to 50% at the 24-hour mark.
50%. So literally half your workforce just doesn't show up to the job site the day after a few glasses of wine.
Or they show up, but they're completely unable to work. They just kind of stand around.
Wow.
But it actually goes much deeper than just the sheer number of cells working. Alcohol alters what these cells build.
How so? Like, did they build something completely different?
They do. So under healthy healing conditions, fibroblasts produce a massive amount of collagen type I. That's your strong, structural, mature collagen.
Okay, type I is the good stuff.
Right. They also produce an enzyme called lysyl oxidase, or LOX for short. And LOX is crucial because it cross-links the collagen fibers together, which gives them immense tensile strength.
Oh, so it's like adding steel rebar into that wet concrete we talked about earlier.
Yes, exactly. The rebar locks it all into a rigid, really strong structure. But when alcohol enters the system, it rewrites the cell's internal instruction manual.
It rewrites it.
Yeah, the scientific papers describe this as reducing the mRNA expression. If you think of mRNA as the blueprint the cell reads to know what to manufacture, alcohol literally edits that blueprint.
That is wild.
It tells the cell to stop making collagen type I and to just stop making that vital LOX enzyme.
Wait, so even just one night of heavy drinking before or after the procedure doesn't just make the builders work slower, it actually makes them build the walls out of cheap, flimsy materials.
Yes. Because the blueprint is altered, it forces the fibroblasts to increase production of collagen type 3 instead.
And what's wrong with type 3? I mean, collagen is collagen, right?
Right. Not exactly. Type 3 is essentially a temporary patch. It's much weaker. It consists of these parallel fibers that don't cross-link well because, remember, that LOX enzyme is missing.
Right, no rebar.
Exactly. So you get a flimsy structure that the body eventually has to spend extra energy to tear down and replace anyway.
That's crazy. You're paying thousands for premium materials,
Yeah.
and your body substitutes it with, like, cheap drywall.
What's fascinating here is how this microscopic cellular failure translates to the physical reality of the wound. Because the body is producing the wrong type of collagen, the physical strength of the tissue drops drastically.
How drastically?
Well, the research shows that wound-breaking strength, which is literally how much physical force it takes to pull the healing tissue apart, is reduced by up to 40% at 2 weeks post-injury.
2 weeks. Okay, that feels like a very specific timeline to highlight in these papers.
It is. The 2-week mark is exactly when a surgical wound is supposed to be entering its strongest remodeling phase.
Oh, I see.
It should be securely knitting together right then. Instead, if you've been drinking, it's highly vulnerable to breaking open. Plus, the wound contains significantly less hyaluronic acid, which is vital for maintaining the moisture and cellular migration needed for tissue repair.
So you're literally cutting your workforce in half, and you're weakening the surgical site by 40%. Just from hitting a BAC slightly over the driving limit.
Yeah.
That is a massive, massive risk. But the sources also make it clear that this isn't just a local problem happening down in the pelvic region. Alcohol doesn't just poison the fibroblasts. It triggers this system-wide alarm that pulls resources away from healing altogether. Let's talk about the immune suppression and inflammation.
Right, because while the fibroblasts are struggling locally, the rest of your body is basically descending into chaos. One of the clinical texts highlights what they call the 20-minute rule.
20 minutes.
Yeah, within just 20 minutes of taking a drink, your body recognizes the alcohol as a toxin, and it immediately shifts its biological priorities.
Okay, so what does it do?
It stops prioritizing the healing of your surgical wound or fighting off potential local infections, and it puts all its resources into metabolizing and clearing the alcohol.
So the liver essentially pulls the fire alarm.
Yes, and while the liver is frantically trying to process the alcohol, things in the gut start falling apart. Alcohol physically damages the intestinal lining, creating a condition known as leaky gut.
I've heard of that.
Yeah, normally the lining of your intestines has these tight junctions that keep what's in your gut separated from your bloodstream. Alcohol physically loosens those junctions.
Which means things that belong in the digestive tract don't actually stay in the digestive tract.
Precisely. That loss of barrier integrity allows bacteria and bacterial endotoxins to slip out of the gut and directly into your bloodstream.
Okay, so going back to our construction site analogy, it's like pulling all the security guards and medics away from the surgical site to deal with a massive riot breaking out across town in the gut.
That is a great way to visualize it.
The surgical site is just left completely undefended.
Completely unguarded. Suddenly, there are bacterial toxins in the blood. The immune system panics, and it floods the body with inflammatory cytokines like interleukin-6 and TNF-alpha.
Just trying to put out the fire.
Right. Your body is basically mounting a massive systemic defense against these escaped gut toxins. And this causes profound oxidative stress and just depletes your natural antioxidants.
And what happens to the actual immune cells that are supposed to be preventing a post-surgical infection in the pelvic region, like the ones making sure the vaginoplasty doesn't get infected?
They're drastically reduced in both number and function. Alcohol suppresses your T cells, your B cells, your macrophages, and your natural killer cells.
Oh, wow.
So you end up with this really dangerous paradox. Your body is flooded with systemic inflammation from the gut issue, but your actual targeted immune defense at the wound site is crippled.
That feels like a recipe for absolute disaster.
It makes post-surgical infections incredibly likely. In severe cases, this compromised immune response can even spiral into sepsis, which is a life-threatening condition.
I think people vastly underestimate what systemic inflammation actually feels like, though. Like they might just think they're hungover.
If we connect this to the bigger picture, this widespread inflammatory state is exactly what causes the flu-like symptoms, the muscle aches, the extreme fatigue, and the generalized swelling that patients so often mistake for just a normal hangover.
They just think they had one too many.
Exactly. They think they're just a little dehydrated from a fun night out. But in reality, their body is in the middle of a cytokine storm, fighting off gut bacteria while their surgical wound just sits there, inflamed and unguarded.
You think you're having a celebratory glass of wine, but you've accidentally started a chemical fire in your own bloodstream.
That's exactly what it is.
And the physical dangers don't stop there. Beyond the cellular damage and the immune chaos, alcohol fundamentally alters the broader physiological environment of your body.
It really changes everything.
It creates very specific, very physical dangers for pelvic and vaginal healing. So let's look at the practical fallout, starting with bleeding.
Bleeding is a major concern, particularly with surgical tightening procedures, like a vaginoplasty or a prolapse repair. The pelvic region is highly vascular,
Lost of blood vessels.
an incredibly dense network of them down there. And alcohol is a known blood thinner. It reduces the blood's ability to clot efficiently by interfering with platelet function.
So if you drink before surgery, or too soon after, you're really inviting trouble.
You drastically increase the risk of postoperative bleeding, forming hematomas, and just experiencing uncontrolled oozing at the surgical site.
Then there's the hydration aspect.
Yeah.
We know healing tissues absolutely require moisture to survive and regenerate, but alcohol acts as a diuretic. How exactly does that work against the healing process?
It's quite direct, actually. Alcohol suppresses a specific hormone in your brain called ADH, or antidiuretic hormone.
Okay.
Normally, ADH tells your kidneys to hold on to water and keep the body hydrated. When alcohol blocks that hormone, your kidneys just flush the water out. You become systemically dehydrated.
And if you're dehydrated, your overall blood volume actually drops.
Right. It does. Lower blood volume means poor circulation, and that translates to less oxygen and fewer vital nutrients actually reaching the wound site.
Why?
And speaking of nutrients, alcohol doesn't just stop them from circulating. It actively depletes the very building blocks your body needs to heal. It flushes out essential wound-healing nutrients like zinc, iron, and various B vitamins.
Not to mention the impact on sleep. Like, a few drinks might help you fall asleep faster, but it completely ruins the quality of that sleep.
Oh, it severely fragments your REM sleep. And deep restorative sleep is the precise window when your immune system does its heaviest repair work and cellular regeneration.
So it's double jeopardy.
Right. By drinking, you're literally robbing your body of its prime healing time.
Which brings us to a really uncomfortable but incredibly important practical danger mentioned in these clinic guides. Pelvic strain.
Yes, this is a big one.
The guides explicitly warn patients to avoid constipation at all costs. Because if you're constipated, you push. And pushing puts dangerous direct mechanical strain on the pelvic floor muscles and those fresh vaginal sutures.
And alcohol is a leading culprit in causing that exact problem.
Right. Because here's where it gets really interesting. If a patient drinks, they get dehydrated because of that diuretic effect on the kidneys you just mentioned.
Mm-hmm.
If they get dehydrated, they get constipated. And if they strain from constipation, they could literally tear the surgical work they just went through all that trouble for.
It's a chain reaction, right?
It's a devastating chain reaction.
Yeah.
You're taking weakened tissues because, remember, the fibroblasts are building that flimsy type 3 collagen because of the alcohol.
Right, the drywall.
Exactly.
Uh-huh.
So you have flimsy tissue, and then you're applying extreme mechanical pressure to them because the alcohol also dehydrated you and caused constipation. It's a direct path to surgical failure.
That's terrifying.
It is. And we haven't even touched on the final critical warning from the clinics. Alcohol interacts dangerously with prescribed postoperative medications.
Right, the painkillers and the antibiotics you're sent home with. Mixing alcohol with heavy painkillers can depress your respiratory system. It can also mask pain to the point where you overexert yourself and damage your wounds without even realizing it.
Because you just don't feel the tear happen.
Exactly. Furthermore, alcohol can render some antibiotics completely ineffective while simultaneously amplifying their side effects.
Wow.
This is why every single clinical guide we reviewed universally advises a strict abstinence period. For laser procedures, it's often a minimum of 48 hours. For full surgeries, it's an absolute minimum of 2 weeks, and often much longer, depending on your individual healing progress.
When you step back and look at the sheer scale of the disruption, it makes you wonder how the body heals at all if alcohol is in the mix.
It really fights against you.
Let's summarize what we've covered for you. If you're getting a tightening procedure, whether it's a non-surgical laser treatment or a full surgical repair, your body has an incredibly complex job to do.
A lot of moving parts.
Yeah, it needs to deploy those builder cells, the fibroblasts. It needs to build strong cross-linked type I collagen to ensure the tissue is actually tight and resilient. It needs a robust, targeted immune system to fight off infection, and it needs to stay perfectly hydrated and nourished to keep the blood flowing.
And as we've seen, alcohol actively sabotages every single one of those steps.
Literally all of them.
It suppresses the fibroblasts, it forces the production of weak scar tissue instead of strong collagen, it causes your gut to leak toxins, triggering a system-wide inflammatory response that pulls your immune defenses away from the surgery.
Yeah.
It thins your blood, it dehydrates your tissues, and it sets off a chain reaction that can lead to physically tearing your own stitches.
So what does this all mean? It means those post-op instructions aren't just polite suggestions from your doctor. They are the strict biological boundaries required for your investment to actually work.
And it leaves us with a lingering, honestly, a rather profound thought to ponder.
Oh, let's hear it.
We know from the data that alcohol forces the body to build weaker type 3 collagen instead of the strong type I collagen during that critical early healing window.
Right.
Could this mean that drinking during your recovery doesn't just delay your healing, but permanently alters the final architectural elasticity and tightness of the result?
Wait, permanently?
Well, think about it. If your body lays down the wrong foundation because of alcohol, the final structure might never be as strong as it could have been. If you're investing your time, your money, and your physical comfort into a rejuvenation procedure, is a glass of wine really worth permanently compromising the structural integrity of your own collagen?
That is a fascinating thought to leave on. The choices you make in those first few weeks literally become the permanent architecture of your body.
It's Cerbering, no pun intended.
Definitely something that will make you think twice before reaching for a drink during recovery. Well, thank you so much for joining us on this deep dive. We hope this empowers you to make the best decisions for your health and your healing. Keep learning, stay curious, and we'll catch you on the next one.